Welcome, as those of you who are coming on. We'll start, I suppose, in a minute or two. So, and I will say that as you're coming on, you're seeing pictures of the Traveling T-shirt Memorial, which is now at CRC until Sunday. And this commemorates children killed due to gun homicide in Missouri last year. Well, there's a T-shirt for each child. Please come by and view it. It's very, it's heart-rending, but it's important that we recognize the toll of gun violence in our community. Okay.
Oh, God.
Okay. Yeah, the youngest victim was 6 months old. That's why there's a onesie there. Yeah. Again, we're gonna start right now, actually. I'm Gail Wechsler, the co-chair of the CRC Gun Violence Chavurah, along with Sarah Heyman, who's here, and Reese's Warling, who's a member. We'll be your host for tonight. I want to welcome you to this program on the other epidemic. And we're talking about the trauma of gun violence. There's a lot of publicity in the news about the numbers of people killed in mass shootings, other shootings, but we don't talk about the people impacted and the trauma affiliated with being a gun violence survivor. So we're going to start things off with Reese's Warling introducing our first speaker, Michaela Sanders.
Thank you, Gail, and thanks everybody for tuning in this evening. Michaela Sanders is a 21-year-old young woman who currently works at Express Scripts as a customer service representative. She attended Fontbonne College and hopes to complete her associate's degree at St. Louis Community College in the near future. Michaela is one of 6 siblings from both her mother and father's side. She describes her family as her backbone, despite many stressors, including incarceration and multiple murders of close family members over the past number of years. In 2014, Michaela lost her sister, Chelsea Harris, to gun violence. Chelsea was an innocent victim who caught a bullet meant for her friend who was driving her home from school. I am a survivor of Chelsea's murder as well, and that's how I know Michaela. Michaela's been involved in Girl Scouts Behind Bars and has experienced public speaking, presenting her story of family disruption, violence, survival, and most of all, love. Life has been hard for Michaela, yet she manages to face each day with a smile that can light up a room. And yes, you're going to all have the good fortune to see that smile now. So without further ado, I'd like to have Michaela start.
Okay. Hello, I'm Michaela Sanders. As Miss Risa did mention, I am 21 years old and I work for Express Scripts currently. I'm actually looking forward to going back to school, college at St. Louis Community College, probably around fall or spring of next year. I have survived a lot. I've survived the loss of my sister, my older sister, Chelsea Harris, along with many other family members due to gun violence. I've also survived the incarceration of both parents. I am the middle child of 6 siblings. I'm the middle child on both sides. I I have had to be the sibling and the daughter. I had to step up as the daughter, well, as basically as a mother and father to my siblings, and also take care of my mother and dad being incarcerated. And I had to take on a lot of responsibilities that weren't meant for me. Losing my older big sister, Chelsea Harris, to gun violence really did impact me a lot. Because we were creating a bond, and we didn't have a strong bond at first. I was around 8. We did not have a strong bond because I was the one to snitch. I told everything. If I couldn't have fun, I told on them, and and they were like, yeah, you can't be around us. Around the age of, I was 13, she was 14. We started to have a bond again, a sisterly bond, and she ended up passing away when she was 16 in 2014. I was 15 at the time, so I still was understanding life. Um, Losing her impacted me a lot because that was my only big sister. So I had to step up and take on the role of, having to be a big sister for my younger siblings. Sorry. Sorry. Losing Chelsea was like losing a best friend. Sorry. Losing Chelsea was like losing my best friend. Even though we didn't have a great bond, even though we didn't have the best bond, we were just starting to build that. I felt like it was taken away from me. Sorry. I was Chelsea's photographer, so she would call me to take any pictures of her if she didn't want to do schoolwork virtually. I was the person that took on the role to take the classes for her, even though I was younger than her, and I probably failed half of her classes, but I did manage to take those classes for her. Sorry. I miss having a big sister, a person that I can lean on, talk to about everything. It impacted me a lot. I still grieve. I still cry about it 7 years later. But I have managed to keep striving for her, and I'm glad to speak at this event. Actually, Chelsea was a wonderful young lady. She was an awesome big sister. She was great and beautiful overall. Her personality was wonderful. I know this may sound crazy, but I do miss being yelled at by my sister. Like I miss the sisterly talks, and yeah, I was impacted a lot by that. It made me feel alone after losing her, but I had to overcome that and know that she wanted me to do better and be a better person. So I continue to talk about how that impacts me, and I also want to speak about her and how it made me a better person today. I am glad to speak at this event, and also I'm glad to speak about my sister Chelsea Harris and how her death impacted me. I do thank you all for allowing me to come here and speak today. Thank you.
Thank you, honey.
Oh, and I do have one more thing to add. I'm sorry. I do think that we all are survivors of gun violence in some way. It may not impact you more than others, but we all are survivors of gun violence. Thank you.
Thank you. Thank you.
Thank you so much, Michaela. We really appreciate you being here. As I mentioned, we will hear from all speakers and then take questions at the end. I'm going to pass it now to Sarah Heyman to introduce our next speaker.
Hello, I'm Sarah Hyman, and or Heyman, I mean, I respond to both. And many of you know me as a member of Moms Demand Action and as a member of our community at Central Reformed Congregation. It is my great pleasure and to be able to introduce Dr. L.J. Punch to this community. Dr. Punch has been on the forefront of treating trauma in the community here in St. Louis, in Houston, and in Baltimore. Dr. Punch has been incredibly important in establishing Stop the Bleed St. Louis, which was offering first aid in order to teaching first aid in order to keep people alive long enough to get them into the hospital so that the operating teams could save their lives. Dr. Punch then went on to teach people how to treat opioid overdoses and make available to the public those things, substantially handling another trauma to our communities. Furthermore, during the pandemic, Dr. Punch was forefront in bringing bringing masks and socks and important other outreaching things to the unhoused and making sure we got vaccines and we were all taken care of. Dr. Punch treats the whole community, from those of us who have nothing to those of us who are most prosperous, and particularly afflicts those of us who need to be afflicted and push us to be better people. Dr. Punch has pushed white coats for Black lives, and now is starting the Brick Outreach Center, which I would love. I personally am so impressed with, and I'm hoping that we'll be able to discuss that today as outreach and treatment for trauma in the community. Dr. Punch.
Thank you, Sarah, and thank you to the congregation for inviting me. In hearing you share, it really brings home to me so much of what my body of work is about. As a trauma surgeon, I've spent the last 2 decades taking care of people whose bodies were impacted by trauma. And trauma is energy transfer. It's when energy comes from one source to another into a human body with the intention for harm. And trauma can come in many forms. It can come as a bullet, it can come as a needle, it can come as a virus, it can come as pain, as it can come as a harsh word, it can come as a missed paycheck and not being able to pay the light bill. It can come as someone you love simply not loving you back. Trauma does not discriminate, and the energy that it brings into our lives and into our communities is devastating. So the reason why a trauma surgeon would end up doing things as diverse as taking care of people in a level 1 trauma center in St. Louis, and also doing things like making sure people had masks and making hot dogs, all beef kosher hot dogs, by the way, is really, really, really all about one thing, right? Which is, to me, what I've learned in this 2 decades of work is that the opposite of trauma, right? The anti-trauma is relationship. And it's incredible to me, the power that we have when we see trauma as a community problem and therefore search for community-based solutions. Sarah mentioned the work that I'm doing right now, which is quite possibly the work of a lifetime, and it's the work that I intend to spend the next 2 decades focusing on, and that's the bullet-related injury clinic. Even the term gun violence, right? Honestly, guys, it's a little stigmatizing. When I hear it, it hits my ears like gay-related immune deficiency, right? Which is what we called HIV before we recognized what it really was. We blame the circumstances, and we don't really think about the vector and the underlying thing that people present with as a disease. Bullets create devastating injuries in individuals and families and communities. And in fact, you could argue that there are certain bullets that have literally impacted the entire world. For instance, the one that ended MLK's life. And bullet-related injury is a constellation of impact from social, emotional, physical, psychological, spiritual, vocational, communal, that I have been basically observing again, and for many, many years as a trauma surgeon. And I recognized that the healthcare system and the way it medicalized what bullets do to bodies was not adequately treating the deeper impact of what happens in lives and in people. So the bullet-related injury clinic is a clinic for people and their families and their significant others and the people around them who were impacted to be able to get self-care support in the many, many ways in which bullets create trauma in our bodies. You know, people understand if you have cancer, you say, I have cancer, and you recognize the ways in which it'll impact your health and well-being. People understand what it is to have a virus and say, oh, I have a cold and that's impacting my well-being. Well, when you have trauma from a bullet or bullet-related injury, it impacts things similarly, but unfortunately, there's not the same awareness in the healthcare community and in the community at large of how those things show up, whether it's inability to eat, devastating pain, inability to sleep, and a real dysregulation. So that clinic is a free clinic that provides those kind of self-care supports, and it's a community internally, right? That's then providing that care externally, where the focus of the clinic starts with the health and well-being of the people providing the care, because healers cannot heal if they themselves are not well. So it's been quite a journey. I learned a lot from St. Louis in doing the work to do Stop the Bleed, and in the work to do Narcan training, and in the work to try to get people in masks. It's all a model of harm reduction, making it so less people die from these really bad things. And in doing that work, like I said, I've been drawn into this much deeper relationship in the ways in which in community we can actually create anti-trauma and help people heal. So I'm super excited. I could say more, but y'all don't need to hear me just go on and on. I'd really rather focus on questions you have. And I really appreciate the chance to share the space with folks here today and the survivors among us. I recognize you and I honor you, and I thank you for your time as well.
Thank you, and again, we will take questions in the chat at the end. Our final speaker is Rabbi Susan Talve, our senior rabbi here at CRC, who you all know as a community activist and a healer in her own right. So I'll let Rabbi Susan take it away.
Dr. Punch, I could listen to you all night and it wouldn't be enough. So thank you. And thank you for being with us.
Rabbi, much love. Thank you so much for joining. And I appreciate it. I just have to give that right back to you right now. Thank you.
I don't know how St. Louis got so lucky to have you. And dear Michaela, you know, you just embody what all of us need to be: courageous, truthful, honest with your feelings. You know, what I've learned from Dr. Punch is that trauma needs 3 things. Trauma therapy stands on 3 legs. The first is creating a safe space. And Dr. Punch, I see you do that, you know, for so many people here, creating a safe space. And of course, that's what our clergy have had to do during this epidemic of bullet-related injuries. The second thing is exactly what you said, Dr. Punch, to create relationships, connectedness. The only thing that can heal trauma is when we know we're not alone, when other people can feel us and can see us and understand, try to understand what we are impacted by. And then the final thing is being able to speak about our emotions. So Michaela, thank you for teaching us. Thank you for modeling for us, because if we can't be in touch with how we're feeling, those emotions are going to come out in violence. And I want to talk a little bit about that. I want to talk about just last weekend, how 8 teenagers were shot. I think there were 24 shootings last weekend, but 8 of them were children. So I know we can all agree, and the reason we're here is because this is an epidemic. It's a public health crisis. And I'm not going to use this word lightly, especially as a Jew, but it feels to me that this is also a genocide. And that's one of the reasons that this is so important for CRC. One of our founding missions is to try to impact the systemic racism of our region and try to make a difference. And so when we see a public health crisis that it really feels very much like a genocide against the Black community, it has to become something that we as a congregation that is integrated, but also as a congregation that takes systemic racism seriously, we need to be in this. So according to the CDC, young Black men and teens made up more than a third of bullet-related injuries this past year, right, in this country. Although Black men and boys ages 15 to 34 make up only 2% of the nation's population, they were among 37% of, I'm going to use the language, bullet-related injuries. Actually, worse than that, they were 37% of homicides, gun-related homicides last year. That's 20 times higher than white males of the same age group. Across all ages, Black men were nearly 14 times more likely to die in a firearm homicide than white men, and 8 times more likely to die in a firearm homicide than the general population, including women. Black women and girls are also at a higher risk. Black females had the highest risk of being killed by a firearm than females of any other race or ethnicity, 4 times more likely to be victims than white females. So the evidence suggests that these homicides, these gun homicides, rose dramatically last year during the pandemic. We won't, of course, know the full scale of the problem for many months to come because the data is just being collected. But the emerging data also suggests that suicides among Black people rose disproportionately as well. Though the study found the majority of all suicide deaths by guns, but 73% were white males. But I remember, but the fact that suicide is up in the Black community tells us that people are living with hopelessness and with trauma. So I remember once when we were fighting the Stand Your Ground legislation in Missouri, a young Black man said, "You think it's easy to pop me now? Just wait until we have Stand Your Ground. You can just call me Trayvon Martin. You might as well just shoot me right here." I'll never forget how clear that was and what he was living with. Imagine living with that systemic reality caused by the very government that is supposed to be here to protect you. Despite its limitations, the gun death data is the most reliable type of gun violence data that's currently available. But as you've heard, gun deaths are only a tip of the iceberg of gun violence. Many more people are shot and survive their injuries, are shot at but not hit, or witnessed gun violence. Many experience gun violence in other ways by living in impacted communities, losing a loved one like Michaela to gun violence, or just being even threatened by a gun. I remember in the early days of CRC, I remember I think about it all the time. It's definitely impacted my life. And I know I'm not the only one, and I don't mean to make it a big deal, but coming out of CRC in the, gosh, it must have been the 90s, I took too long. And a couple of guys came up and put a gun in my face. And, I gave them my keys and my money. And I looked at that. I'll never forget. I looked at the kid in his eyes. And one guy said, "She saw your face, blow her away." I'll never forget that. But there was something in that kid's eyes, and he didn't shoot me. I was really lucky. But I tell you, I feel it. And I only mention it not because I feel like I'm a victim, but because I've been so lucky, and I live with so much privilege. But I mention it because I know that there are so many people that are walking around afraid. And I wonder what that trauma and that fear is doing to us, because I believe that whole families, whole communities are suffering from trauma from this. And we all need trauma-informed therapy. We've all heard these conversations, and there's so many ways to frame this conversation. The conversations on the outrageous violence that we tolerate in this country from guns. And I know you've heard so many of these conversations, and I'm grateful to Gail and Risa and Sarah and the Gun Rights Chavurah for wanting to address the trauma of gun violence and the cost of this trauma on the soul of our people, the soul of the nation. And again, I can't say it enough. I'm grateful to Dr. Punch and the others who take the conversation, the numbers, and the science and are doing something to heal the victims. Yes, from their physical wounds, they have to, but also from their emotional and their spiritual wounds as well. Because trauma undermines our humanity. Trauma can keep us stuck in cycles of violence, and trauma gets into your DNA. It's inherited, and it can be passed along with all of its violent behaviors from generation to generation. And trauma can keep us from lifting ourselves out of the situations that threaten our lives and the lives of those we love. Because trauma leads to hopelessness, self-medicating, and an inability to deal with one's emotions in a healthy way. And we are all part of this traumatic epidemic of bullet-related injuries. And we need to choose sides. More of us need to choose sides and not stand idly by. We have to find our lanes in this fight if it's going to change. In the words of Judith Herman, who wrote a book called Trauma and Recovery, she said, "It is impossible to remain neutral in this conflict. The bystander is forced to take sides. It is very tempting to take the side of the perpetrator, because all the perpetrator asks is that the bystander do nothing. The victim, on the contrary, asks the bystander to share the burden of pain. The victim demands action, engagement, and remembering." So we know we need systemic policy changes that get to the root causes of the suffering. We are being called to transform a nation that has been built on the backs of slaves to one that truly does see and value the infinite worth and the godliness of every single person. Absolutely everyone, regardless of the color of their skin or their ethnic origin or their gender. It used to be when we would hear, when I first came to St. Louis, like many of you, I would go. Remember when the days when we would go to the shoot, there would be a shooting and we'd go to a street corner and we'd put some flowers and a teddy bear and some balloons and we'd pray. We did it a lot. So we began to recognize each other after a while. We witnessed and we honored every life. We made sure that every grieving family knew that we knew that they would never be the same, that they were broken beyond repair by the violence, and we were their witnesses. But you know, it's been years since we could keep up with the shootings. But like many of you, I still force myself to open every report of every shooting, and I imagine the families like Michaela's, the families like the families of all of those children, those babies that are represented by the t-shirts now at CRC. We couldn't possibly mark the places today. It would be a full-time job. You know, it used to say, and it also used to be that we could say that the violence in St. Louis was along one corridor. We could name the hotspots, but today, I'm sorry, there are no walls high enough. There's no escape west enough because gun violence is everywhere. Over the years, we've seen so many attempts to reduce the violence. De-escalators, hotlines, trauma therapy, increasing substance abuse programs, opportunities and detox beds for addicts, gun locks, buybacks, job training, focused deterrence, stop the bleed, of course, and cure violence. They're all good. We need them all. We need every one of these programs. Not one by itself will be enough. We need them all. We need the Band-Aids that save individuals and stop the bleed, that lift people out of poverty. And sometimes we need to send people out of St. Louis. How many times have we had to send people because of revenge shootings out of St. Louis, out of the hand of the revenge killings that keep the cycle of violence going and going and going? And we all know that we also need the systemic structural changes in law enforcement, in public safety that is not safe at all if you are Black. In the school to prison pipeline, we need changes in our segregated schools. We need changes in our shrinking city and in the disparities we allow to exist that cause so much suffering. We know. And we know the root causes. We know we have to do something about it. And still, it seems the more we do, the worse it gets, especially for the children caught in the crossfire, the children playing with guns as available, maybe even more available than their toys. So one thing that CRC was involved with, that I was involved with, was 2 summers ago, I'll make it quick, when gun violence was killing so many of our children. A group of clergy met with the governor. He wanted us to come up with a plan to address the epidemic that was killing so many, but he didn't want us to talk about gun reform, of course. We offered many suggestions, common sense gun laws, but the idea that he was most interested in was to create an after-school program that became what we called the Village Safe Space Initiative. It was originally organized by a new clergy group called the Missouri Faith Leadership Council. We organized quickly, we received $400,000, and the idea was to work with 7 established grassroots not-for-profits that already had relationships in the hotspot communities that we were planning on serving. The program director would mentor the not-for-profits who already had the relationships, and we would train them and give them monetary support and more. The St. Louis Public Schools was going to provide space, food, security. It was going to last from 3 p.m. to 10 p.m., times when there were a lot of shootings. Local churches were providing safe, informed transportation, and different agencies were on board to provide grief and trauma counseling, as well as academic support and extracurricular activities. We opened up and it was going great for a few weeks until COVID hit and the schools closed. So we had to, right away, we had to pivot. We had to create something new, and we did. We created a commissary at St. James Church in the Ville. The not-for-profits did what they could to stay in intimate touch with the families. We started out with 500 families. We grew to 800 families, and today we have 2,000 families. Mostly it was about not delivering food, but using food delivery as a way of staying in touch with individual households to find out what they needed, to address their concerns. Each one of them, a whole different world. There wasn't one fix for all. And, we did lots of programs, and what I can tell you is that at least today, these 2,000 households that we have served, there has not been one bullet-related injury that's been reported by our not-for-profits. So we're thinking that, this is just another way, being in relationship with families, having somebody care, having it be faith-based, seems to, at least in our little catchment area, seems to have made a difference. Trauma caused by gun violence is so destructive because it affects not only the victims, but it affects their friends, their family members, their neighborhoods, and their communities. The mental health effects of these bullet-related injuries can include anxiety, depression, PTSD, of course, domestic violence, trouble in the home, and this despair of hopelessness. And as I began, I'll end. The 3 pillars of trauma therapy are creating safe spaces, making those connections, letting people know you care about them. I think about that kid. I looked into his eyes so long ago, and in my imagination and my naive way, I think maybe he saw an auntie. Maybe he saw his grandma, maybe he saw somebody he knew, something familiar in the way I looked at him. I don't know, but I do know that relationships, connectedness heals us. And then finally, we need to help. We need to help, especially our young people, deal with managing emotional impulses that isn't just with cannabis, that isn't just with, power or our gangs, or we have to find ways for them to express in healthy ways their emotions, because we cannot afford to lose any more precious souls. We cannot bear to lose our children. And in addition to addressing the very necessary gun legislation reform, in spite of that idiot judge in California, in addition to lifting people out of desperation and poverty, we also need to address our individual and collective trauma by providing more safe spaces, by reaching out, by supporting efforts like Dr. Punch's, making connections and doing our best to teach how to manage emotions non-violently, without substance abuse, and mostly without guns. So friends, we're going to keep talking and doing and trying to reveal the root causes of this awful epidemic of gun violence that is stealing our children from us. And together, we will continue to believe that we can make a difference.
Thank you so much. Thank you to all of our speakers. This really has been, you've each really helped us learn more and really get into this issue of trauma and gun violence. For questions, please put them in the chat. I'll start with one, and we have a few more. Can any of the speakers address it was touched on, but what concrete things can those coming here tonight do in terms of helping survivors, working in communities, supporting the BRAC, anything you can offer concretely that people can do after they leave tonight? And I'll do my usual shout out to Moms Demand Action for Gun Sense, which is doing a myriad of things to try to address each of the different aspects of bullet-related injuries and bullet-related deaths. So there's info in the chat on how to become a supporter, and any suggestions on that question.
I can share a little bit about direct support for people who are coming through our clinic, because that is the most vivid depiction of the things that people need when they're in acute recovery. And I'm going to say that while it can almost seem unsatisfying to think about pouring resource and energy into people after the fact, it is my deep belief that the unhealed trauma that's in the lives and bodies of people who are shot is exactly the true gunpowder that fuels future episodes of bullet-related injury. So, if we just think about the numbers, if 2,500 people plus were shot in the city last year, and 50% of them were sent home from the ER after a couple hours and a Band-Aid, that's literally, right, a few people every single day coming back into the community with inadequate support to heal. So what are the things that people need? So the immediate needs are things like pain control and wound care. So we spend a lot of time with everything from Tylenol to ibuprofen to ice packs to lidocaine patches to ACE bandages and Band-Aids and nonstick Band-Aids and Neosporin and all kinds of things. And I see Jacqueline is actually on this chat right now, and she actually came through the brick and offered some free OT services. Lots of our people need crutches, walkers, and other kinds of assistance. We have people who need physical therapy, so resistant bands and squeezy balls. So there's like lots of body care. So we've had a few people who, for instance, have had episodes in their life where they needed wound care and then they healed, or they had a loved one that needed it, and they bring their leftover stuff. So there's sort of a whole gamut of medical supplies, walkers, crutches, things like that we need, that we use all the time. Slings, that's been our latest thing. We've been going through slings a lot. The other thing, people have an immediate disruption usually in their communication and transportation. People's phones get confiscated or broken. People's cars get detained. People have cars that are messed up because of the event. It's astonishing how many people are coming to us to the brick after having an event that was related to them being in the car. And so bus passes, Lyft rides, track phones, like burner phones. We're trying to give people communication and transportation support immediately so they can just get through their lives. Immediate vocational instability. So people are physically hurt, so they can't work. And many people are coming to us with jobs that don't have family medical leave or insurance or any of those kind of relief. So they're like, if they don't work, they don't get paid. So a $50 gift certificate so people can go to the grocery store and grab some things is a literally people have been crying in the clinic because we gave them some money to go to Schnucks and get something to eat that night. I mean, it's to that point because there's just such a profound disruption. Then for the family members, especially kiddos, so if the people have kid children or they have significant others who are carrying the weight, or oftentimes significant others were there or nearby or carried it, we're doing things that are fun, like toys for the kids, like a ball or something, or a coloring book or a journal, crayons, markers. And then for the significant others, we have wellness boxes that we basically are being donated, and they have things like tea and aromatherapy and a new pillowcase and just things that kind of are generally trying to communicate to the surrounding folks that you're safe now. So all of this is, I have a coordinator named Indigo who runs the clinic, and I'll put the email for that contact in the chat, because, you know, a coordinated effort from a group like this to support. One of the things we've thought about is like, should we let people sort of adopt individual brick participants and their families? So anyway, lots of different ways that you can do and support. And I also saw a question in the chat about how the brick is funded. So BJH and DePaul hospitals have provided funding that results in about 14% of the BRICS budget being funded. So yeah, dream no small dream, but we're doing it. But we also got an anonymous donation from the Community Foundation. That's going to keep us open through December 2021. We do not have a plan after that. And all of the services that are provided by medical professional are free, including me. I do not get paid to do the BRIC, and none of the volunteers like Jacqueline who come through get paid either. So yes, that's how it's working, and that's what we need. We need bodies, we need things, and we need love. And most of all, your loving prayers and directing that healing energy toward the folks that are coming through our building as a healing space would be just totally invaluable.
Great, thank you so much. There's a question from Michaela. Again, thank you, Michaela, for sharing your story. Can you share what support from family and the community made an impact for you, both as a teenager and today? And what support do you wish you had when your sister was killed and you were healing? If you got all that, it's in the chat too.
Okay, sorry, sorry. So I do have to go back to the question. One moment.
From Lydia? From Lydia.
Okay. You're welcome. So some support that I have had from family and community. Miss Risa was big support to me, and Sister Jackie, Sister Jackie has been in my life since I was 12 years old. But Miss Risa, I met Miss Risa after my sister had passed away through Sister Jackie. And when I met Miss Risa, it was actually around Valentine's Day of 2016. So right after my sister passed away. No, 2015, I'm sorry. Right after my sister passed away, I met Miss Risa, and she was a big support. She helped me through everything as far as managing. I also have a therapist now that I speak with every week about all of the issues in my life. So that has helped me out as well. I'm still kind of grieving over the death of my sister, but talking to Miss Risa and Sister Jackie and my therapist helps a lot. As far as family, I don't I don't really have the family support as I'm supposed to. So Sister Jackie, Risa, and my therapist are like family to me, and they support me the whole way through everything. So yes.
And we also have in the chat, you can see some of the supplies that would be helpful and the hours of the BRIC. And additional questions, we'd love to hear from you.
Can I just make can I say one other thing? A new program, which we're launching July 7th, 7/7, is a support group for survivors. We're going to have two gentlemen from the Village Path, social workers who graduated from SLU, who do therapy focused on masculine-centered Black bodies, but recognizing the spectrum of humans who would benefit from the work they do. So they're going to be doing this therapy for any BRIC participant and their families. That's a big one, and we're really excited. We're going to pilot this for 10 weeks, and we don't have a plan for how we're going to be able to continue it after that, but it's a big one. And we also host a connection to the Sibling Support Network. And Michaela, I'm hoping you've heard of the Sibling Support Network. That's run by Shiraz Gorman, and it's specifically for folks who are dealing with exactly what you're dealing with. I'm so glad you have the body of folks around you who are supporting you. And that network provides support with people who understand exactly the situation that you're in and what your heart has had to endure. So I'll put those links in the chat as well.
Okay, are there other questions or thoughts from anyone in the audience tonight? Let me see it. I might have missed a question. Let me look. Well, there's a question for Dr. Punch about, I guess, how do you get your referrals of people to the bridge, and do you need help with outreach to get more people to come?
Y'all gonna get us blown up now. If I put this through, if I let this through her advertising,
No pressure. No, just wanted to know. Sorry about that.
No, but okay, so this is real, right? So the problem is, or the challenge, the opportunity is that we are totally underfunded and under-resourced for the scope of work. So the pilot project, right, that was set up with DePaul Hospital and BJH is for 100 patients in 1 year. That's what we calculated would be our caseload if we had a 20% catchment rate from the folks going through those ERs. The truth is we're at about a 50% catchment rate, and we're totally overwhelmed just with those two places for referral, having me and one clinic manager and one clinic coordinator and a whole lot of volunteers. And so we need help internally to get to scale. Right now, our biggest clinic is happening on Saturdays. We'd like to have another day of clinic, for instance, on Sunday or Friday night or Wednesday, but we need bodies to help us organize and staff those hours consistently before we start really putting the word out there that we're available. Now, those two hospital systems refer to us directly through a system that is REDCap, but we do take one-on-one referrals from people in community or individuals who just want help outside of that referral pattern, just because we want to make sure we're available to folks who really need us. And sometimes just 1 or 2 visits can make a huge difference in someone's recovery. And so yes, you can go to the website. I put in the chat. You can see right there. It's at the top. Click to enroll somebody, and we'll take that referral from anyone. But before we really start getting this at a larger scale, we've got to be able to operate at a larger scale, because we certainly don't want to traumatize people in a way that they'd be waiting for help. And let me tell you though, we were supposed to have 100 people in a year. We're at around a referral number 170 at month 5.5. So we're totally exceeding those expectations. Once people come to see us once, they are 87% likelihood of coming back and seeing us again. That's astonishing. And our no-show rate at our clinic on Saturdays is extremely low. So once they see what we got, they come back. And that's important, because that's how you're going to develop those relationships that are the healing part. The other thing that's really interesting is how many people we don't connect to simply because they don't have a working phone. So one of the things we've dreamed about is being able to have a presence inside the ER, for instance, at SLU, at Christian, and at BJH, where there's so many patients coming through, where we could have a more direct connection and start that relationship. But we do begin the relationship by giving everyone what we call a brick box, and it has wound care supplies, pain control, and an invitation to come see us in our clinic, even as a walk-in. So we're trying to do the best we can. We need to get our data, show the impact, show the cost-saving model, get the healthcare systems to get behind it, but we also need the community to recognize what a unique service we're providing and why it's worth supporting the BRIC.
Wonderful. We have a question for Rabbi Susan. Let me catch it here. Hold on. Oh, yes. How can we help the outreach program that you talked about, Susan?
I always have a list of volunteer opportunities. We have a couple of different things happening this summer, but get in touch with me, and I'll certainly will. Now that we've got some more capacity with Autumn on board, maybe the Chavurah wants to I don't know, there are some ways that we can really work together, since really our focus, our goal was to reduce gun violence. And for some reason, this one-on-one approach to these 2,000 households has made a difference. And, you know, I mean, our goal is to put Dr. Punch out of business, right? We want to put Dr. Punch out of business. We want to really, you know, but until that time, Dr. Punch, we're hearing the resource. I'm hearing the resources again, and I know that we can be more help. I know that we can have some kind of a focused relationship with the BRIC, right? And I'd also like to bring my other partners from my St. Louis Resource Collaboration Foundation in on seeing how we can help, because, you know, this does reduce, what Dr. Punch is doing is it reduces gun violence because it's reducing the trauma. You know, I mean, when somebody knows that somebody cares about them enough to help them heal physically, spiritually, emotionally, they're not going to go back out and get hurt, you know. And I think what we learned from, you know, the what was the program that's at the hospital called? My brain's not, I know I even mentioned it, but
The Life Outside of Violence, LOV.
yeah, right. You know, like catching people right at the hospital, what they kept finding was that it was the same families coming back and back again and again and again. And so we've got to address, we've got to figure out how to stop this cycle of violence, you know, and love.
Dr. Punch, this is Risa. I remember you speaking a number of years ago saying that it's very rare when you were operating on someone that you didn't find other bullets. Nobody was just a neophyte. Everyone just comes back and back again.
Right.
And I hate to conclude this in this sort of negative fashion, but, you know, until we can get the guns off the streets, you know, until we can get legislators to make it harder to own guns, you know, what we do, our jobs are much, much harder.
They're harder. But when you have a judge that thinks that a machine gun is the same as a Swiss Army knife,
Right.
I mean, we really have, it really makes a difference who our judges and our legislators are. And we have a big uphill battle. And, you know, Michaela, it's your voice. It's your voice. It's your generation. You know, we will listen to you. People will listen to you. You know, you've got the voice. We'll support you, but I think, you know, Risa's right. We really have to. We certainly have to come at this from every way we can, and give people support and really respond to the trauma in smart ways. And we have to get the systemic. This is not happening by accident. I think that's the other piece of this. You know, there are people, that certain people, because of white supremacy and the legacy of slavery in this country, that think that certain lives don't matter as much as others.
Well, even the fact that the Second Amendment exists with the language that gun rights are to be legislated at the level of the state was embedded, right? Embedded in Virginia, wanting to be able to control its disproportionate population of slaves at the time. I mean, this is like nitty gritty. This was about reproducing and sustaining the economic realities of chattel slavery, and it continues today. And here's the crazy thing, and I'm not to use an ableist word, but this is just not a good thing. In terms of people, the people whose lives are most often ended by bullet-related injuries are white men between the age of 50 and 70.
Yes.
And so people would rather perpetuate as long as something that's killing them, just to be able to maintain and keep the structural realities of racism alive. And when, Ms. Risa, I hear you. That's the conversation we have to have. In the meantime, though, regardless of what's going on with guns, the disease that bullets cause is not even being addressed. It's not even being treated in the most basic way, right? So I think I'm glad we're having this conversation at these many levels, and the many people on this call have the ability to resonate at the level that gets their blood flowing the most. And I think it takes all of this, right? It takes all of this to really tackle the enormity of this problem. This is the #1 killer of Black men aged 15 to 34. And it's literally a silent disease. This is why.
Yeah.
I will also say that we don't have much time left. There were questions and comments about politics and what can we do on legislation. That's probably another program, which maybe we'll have. But again, there's another post from another wonderful mom, demand leader, Randy Steffen. It's really easy to become a supporter of Mom Demand Action. And we don't just do legislative work, but we do legislative work at every level, local, state, and federal, and we don't give up. And even if we're just putting out fires, you know, what I say is if we've stopped a bad gun bill from passing, we have saved some lives. So, you know, we can't stop. That's got to be part of the puzzle. The gun violence, Chavurah, maybe that's another one we'll do next time. But in the meantime, I urge you to join Mom's Demand, and we stay tuned. It's likely that we'll put together a supply drive and other activities to support the BRAC. So thank you, Michaela, Dr. Punch, and Rabbi Susan. It's been real eye-opening, and your passion is truly amazing. And if that doesn't help us get to a better place, I'm not sure what will. So again, thank you all for coming. We appreciate you. Bye.
Thank you, Gail.
Thanks for coming, Sarah Ann. I see you. Sorry we didn't really address your question, but talk to me. I'll tell you more. Yeah, I can stay on a little longer.
Thanks, Gail. Okay, great.
Yeah.
Well, we've got.
Well, we've lost some of
Thank
us.
you again for everyone who's here. There's a lot of wonderful people on this call who are already doing the work. I know.
You know, you do